Coming up on the Doctor's Hospital podcast.
but understanding that the cost of treatment was desperately needed. And each year, the Capital the Sigma Alumni Chapter, along with our affiliate groups, we raise funds to donate to Sister Sister organization.
Doctor's Hospital Specialist Clinic is where trusted and best care meets consistency and dedication. Let our expert specialists take you on a healthcare journey where warmth, compassion, and your well-being come first. From diagnosis to prescription, we are with you every step of the way, ensuring your peace of mind. Visit us today at Centerville Medical Center, Collins Avenue and 6th Terrace, and discover quality, compassionate healthcare at Doctor's Hospital Specialist Clinic.
Welcome to the Doctor's Hospital podcast. I'm your host, Alexis Burrows, Marketing Director at Doctor's Hospital. Today, we are excited to continue our conversation around breast cancer awareness. And we have with us Monisha Rolle, who is a radiology technologist here at Doctor's Hospital, also our lead mammographer. Gotta make sure I say that right. And we are happy to have her on to talk about the Doctor's Hospital Go Pink initiative. So welcome to the show, Monisha.
Thanks, Alexis.
All right, so let's start at what kind of led you into doing this initiative in the first place. Because I know from going back to last year, the first event that we did, I know this is essentially your brainchild. So what made you want to do the Go Pink initiative in the first place?
Well, the Go Pink initiative is more than just a campaign that we're doing.
Mm-hmm.
It's a driven by a deep desire that I actually had um, through education and the support to individuals diagnosed with breast cancer,
Mm-hmm.
as well as their loved ones. Before I entered the medical field, I witnessed parents during my primary and high school years that lost family members and close friends to this disease.
Mm-hmm.
So this emotional experience ignited a passion inside of me to help women, both young and old, starting with the basics to help breast cancer prevention.
Okay. Um, so this is something I guess that you it almost feels like you've been building towards this for a very long time.
I have actually for several years. I've been an entrepreneur and I led to doing different fundraising events and
Mm-hmm.
donating to breast cancer warriors,
Mm-hmm.
whether it was support their treatments, assist with their purpose, or their purchases of parts that are required.
Right.
But understanding that the cost of treatment was desperately needed, especially for those without insurance. This was my way of giving back.
Mm-hmm.
And now, as a technologist and a lead mammographer at Doctor's Hospital, my commitment has only deepened. And in my role, I had the privilege of helping hundreds of women by offering them a listening ear and guiding them through their self care and self breast exams, just to prepare them for their mammograms or their ultrasound.
So, from your perspective, then, Monisha, why is an initiative like this so important? Like, we know that when we get into October, there are a number of different organizations and events that happen. You have for fundraising, for raising awareness, for discounted screening, all of these different things. So, from your perspective, as somebody who is deeply integrated into the industry and the imaging space, so your screening and diagnostic space, why is an initiative like Go Pink so important?
Well, GoPing was actually very important to me because, like I mentioned prior, it is something that was helping persons deal with their emotional experience as well. For those who were diagnosed with cancer or at least have family members that probably passed away in the past. And with the imaging department support, the hospital has gone above and beyond by offering discounts not only during Breast Cancer Awareness Month in October, but extending these throughout the year, making a significant difference for the many families. And this has allowed us to continue emphasizing the importance of early detection and regular screening. Plus, we have the opportunity to not only cater to October that majority of persons are aware of, but we're actually focusing on the entire year just to help raise their awareness on a regular basis.
So I think you mentioned earlier that this event came about as a part sponsorship with the sorority that you're involved in. Can you tell me and tell our audience how that partnership came about?
Yes. Well, 3 years ago, I launched a buddy system with fellow members of my sorority, Sigma Gamma Rho Sorority Incorporated, where I serve as the vice president of the Kappa Delta Sigma alumni chapter. This initiative marked the beginning of a strong relationship between the hospital and the sorority, both of which are committed to community service. And under the Women's Wellness Initiative, one of which is our top 5 national programs at the sorority, this focuses on health issues impacting women, particularly women of color. And through this initiative, we encourage women to live healthier lives, and the body system serves as an ongoing source of support for those preparing for their mammograms. We want individuals to always know that we are here, and we want you to not be worried about what's going on, but know that you do have a sister here by your side.
Understood. And you mentioned this is less of an event and more of an ongoing initiative. So, what do you anticipate that people will get out of this ongoing Go Pink initiative?
But last year, I envisioned taking coping to the next level by increasing the awareness in a larger, more engaging way. And while October is widely recognized as Breast Cancer Awareness Month, we encourage women to register for screenings in September, demonstrating our hospital and sororities' unwavering commitment to spreading the message year round. And each year, the Kappa Delta Sigma Alumni Chapter, along with our affiliate groups, we raise funds to donate to Sister organization here in New Providence. And also we have the MAP program in Grand Bahama that I'm also a part of as a Lemonista. And with the support of Doctors Hospital, we've been able to continue this tradition as well. But through Doctors Hospital, which stands on their commitment to being able to be the best healthcare provider in the region, we want to work with the best. So that's why continuing the partnership with Doctors Hospital is very important, and knowing that we have built a relationship not only with them, but I've also been able to build relationship with my patients. That continues to bring each of us together in a more family oriented environment. So
Hmm.
more persons will be able to be more comfortable while coming out and having their screenings done.
Okay, understood. Um, you mentioned obviously the partnership from the doctor's hospital perspective. Can you explain why and how important it is to have DH being a partner with an initiative like this?
Definitely. Doctors Hospital lives on their standards, and they focus not only on the We Care slogan, but they want to make sure that they're in the organization, they're helping their communities, and persons like myself, who is also here to be an impactful and part of the organization. We want to continue collaborating so that we can get the message out there on a larger scale and not just focus on just a 1 month type of initiative. We want to show persons on a regular basis that we are here on a daily basis for them to make sure that we are getting these numbers down because we want to decrease breast cancer as much as possible.
Understood. From your perspective, how do you want to see this initiative expand in the future? Um, are you looking at things like survivor groups or support groups, like building out things like that? Like, what is your in a perfect world where you had every resource at your fingertips to turn this into whatever you wanted it to be like fully impactful and very helpful in this specific area, what does that look like to you?
Well, the ultimate goal for me is to empower as many women as possible, ensuring that they know that they are not alone in the fight. I want them to see that there are women like me who are not only there to perform their mammograms, but to support them throughout their mental and emotional journeys as well. In terms of having the big impact, I also want to collaborate with past survivors who are now able to share their stories with persons who are now being diagnosed with the disease itself and build more collaboration. So have things on a larger scale where whether it is actual forums or having different events that we can also raise awareness and make it something fun and exciting so that people can be comfortable, but knowing that you do have a lot of other support here in one room so you can ask questions on a regular basis and you have that support there that is needed.
Okay. We are having a great conversation with Monisha Rolle, lead mammographer in the Doctor's Hospital Imaging Department, about her Go Pink initiative. But right now, we need to take a quick break for some words from our sponsors, and we'll be right back on the Doctor's Hospital podcast.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctors Hospital Clinics, your trusted destination for comprehensive care. Our full service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Welcome back to the Doctor's Hospital podcast. We are continuing our conversation on the Go Pink initiative with Monisha Rolle, our radiology technologist and lead mammographer here at Doctor's Hospital in our imaging department. So, obviously you've been working at this for a little while now. What advice would you give to someone who is trying to build out something like this? Maybe in a different space, a different area of focus, but obviously you've had to work through, I imagine, a lot to get it to this point. What advice would you give someone who is seeking to build out this sort of initiative in their own way and in their own space?
Well, the first thing is I want persons to always familiarize yourself with your committee and your community because you definitely need to make sure that you are building a relationship with your physicians and facilities that do have top quality and they offer you not just the best on equipment, but they offer you the best in their quality standards and you know you'll be able to trust them. And you want to let patients know that you do care for their health. You are empathetic to everything that is going on. That way they can be more relatable and be able to be more comfortable speaking to you and open up to say that, okay, I do have a problem. I know that I'm not really focused on what is actually happening because I'm probably afraid, but you want to be able to be that person right there. So it's all about building that trust and really getting to know exactly what resources you do have out there.
Hmm. Um, how critical, from your experience as someone in this mammography space in particular, how critical is it to have conversations like these and like the ones that I imagine come out of events and initiatives like Go Pink?
Oh, it is very, very critical because we do have persons who come in who may not even know that they do have a family history. And simple questions like we do during the regular screening process, we have to ask whether you have any family history based on your menstrual history, certain backgrounds, even in terms of like breast surgeries, any complaints. We need to know that ahead of time, mainly because we can key in on different areas because sometimes what persons don't realize is not because you do not have a complaint means that you do not have breast cancer. So that myth is something that we're actually working on with a lot of persons when in terms of actually guiding them and educating them. But you want to make sure that you're able to continue speaking to people and just opening up, letting them know that, hey, this is the tools that we have out there. In the event that your results do come back positive, then we do have additional studies that you can do, such as ultrasound or MRI, breast, or even a biopsy. That way we can actually treat things early if needed.
Okay. Um, and I know I think this is a common thread in conversation, but that early detection, how critical is that in a space like breast cancer, given everything that we know about the prevalence here, the mortality rate here? How critical is it to have these conversations and drive people particularly into that early detection, early screening space?
Well, for persons who are under the age of 40, we do have persons who are passing away from breast cancer, and that actually stems from not knowing family history as well. And you do have persons who might actually be the first in the family to have it. So it's all about really getting familiarized with your breast, continuing doing the self care and the self breast checks. And also knowing if you notice something by either doing the checks in the mirror where you're doing it while in the shower, you want to get familiarized with your breast. And we do have females that are a little bit shy in terms of going to the physician and allowing them to assess them. So the main thing would be to encourage them to start doing their annual screenings. You need to get out there, especially once you have already started developing. You want to make sure that you're in the doctor's office on a regular basis. Once a year is quite fine. And you don't want to actually bypass the 1 year mark because anything can actually happen. But at least by doing it yearly, you're able to really catch it as early as possible.
Yeah.
And once you are at the age of 40, you can start your mammograms. And the insurance companies offer free mammograms once you have already reached that point because that's your screening tool. Now, for persons who might have what they call dense breast, we need to continue doing the breast ultrasounds to accommodate and to go along with the actual mammograms so that you can pick up whatever details in between. That way you don't miss anything and you have the opportunity to really get details from trusted radiologists that would be able to guide you further and then just continue following up with your physician as well. Don't be afraid of what the results actually show. Just really focus on what it is that you know you're coming here to get an actual screening to prevent anything. So just stick with doing that and then just leave the rest um, up to God and know that, hey, just walk in faith.
Yeah. I have an interesting thing for you to consider. This is probably a different direction than I've done with anybody on the podcast in the past, but just something that I thought of as you were talking. Um, there might be an opportunity for, someone like you who obviously has a very strong interest in the space. And one of the things you mentioned is a lack of knowing the family history. Maybe there's a project there to kind of try and get some research done, doing some going back into the archives and trying to pull information. Because I imagine, we live in a world now where data drives so much of what we do, from a marketing perspective, from a healthcare perspective, from so many different angles. There's not a business worth its salt that's not involved in the data space in some way. And I would say, I would almost dare say, challenge you to perhaps take that up as a cause out of this Go Pink initiative, to actually go and see if there's a way to find the information and to get people better informed. Because like it's funny, me and my team, I came into the office a couple of weeks ago, and they had found this website that has like basically your entire family history, and they were able to show me like my great great grandfather's name because they compiled all the records. So that's kind of informing like my mind process here a little bit. Like, if there's a way to go and gather that information and actually help to give people sort of an understanding up front, in as far as that's possible, I think that would be an amazing thing to take on, and it would have such a massive impact on how people are able to navigate the space. Because we see it, like I know people, friends and family members who, are under 40, and were diagnosed and had it very aggressively and didn't make it out on the other side. And so there's so much to consider in how we try to understand and better combat something like this that has taken many lives. Like, I know for me, we're talking about the screening process, and I couldn't help but think about my mom. My mom was getting her annual every year. And 1 year there was nothing. The next year it was there. A year and a half later she was gone. And it was just like that. And so from that perspective, to me, yeah, if there's anything that we can do to help and spur this on in a direction to have an even greater and deeper impact, then I would definitely encourage you to do so. And you're kind of as close to the data as someone can get. So I think, that might be something for you to take a look at.
I really like the idea because I am very big on innovation.
Hmm.
So really digging deep to see exactly how I can assist with persons knowing their history and being able to really break it or at
Hmm.
least support them as much as possible so that they can catch it as early as they can or however they can get treated prior. That is something that I'm totally agreeable with.
Yeah.
So I definitely will be looking into that, and this will give me the opportunity for 2025 to really see exactly how big we can get Go Pink to really go,
Hmm.
and just continue to grow from there.
Sure. So as we wrap up, I think obviously the last big question is, what else is happening with Go Pink for the remainder of this year? Where can people find out more about what's going on? Are there any more events or in-person engagements where people can kind of get involved? What does this look like between now and the end of the year?
Well, September, we usually have one Go Pink event where both the chapter along with the hospital comes together and just have something where persons are able to get their mammograms at a discounted rate. We do it in collaboration with the blood drive as well because we know we do need blood donors. And we did a bake sale. So that was something that we did to kick off for the end of September. And now we're just focusing on just raising the awareness. So Doctors Hospital, along with Kappa Delta Sigma, we are going to be doing pop-ups at
Hmm.
different facilities. And we are going to actually be at the Fun Run Walk on Saturday for the St. Jude cancer, for childhood cancer. So we're going to be out there for that. And the imaging department is definitely going to be on a continuous move because, like I said, we want to raise the awareness. We want persons to know that we are here, and we want to continue to help our community as much as possible. And you can actually find out more information as flyers drop. You'll find it on either the Doctors Hospital website or doctorshospital.com, or you can find the Capital de Sigma chapter on either their Instagram page, which is kds.sgro, or you can find us also on Facebook. But I'll definitely be having different things pop up. So as long as persons see Doctors Hospital, Kappa Delta Sigma, and Monisha Rolle on different things in
Hmm.
terms of coping, they know that they can always just follow us, and we'll just make this really, really big in the months to come.
Awesome. Sounds great. So much love and support for this initiative, and we wish you the best success as you continue to expand what is even possible in the world of Go Pink and in your work to bring about more awareness, more support, and more assistance to people who are going through fighting breast cancer. So thank you very much, Monisha, for taking time out of your schedule to be on the podcast today. We greatly appreciate you.
Thank you, Alexis. Thank you for having me. Oh, and I do want to also include for anyone who's interested, if they want to ever help support the Go Pink initiative, we actually do have a account that we've
Mm,
created at Doctors Hospital as well, so that we can help persons who are in desperate need of having mammograms that aren't able to afford it. So they can also just try to reach out even directly to the hospital, and then they can find me, or they can email me at mroll@doctorshospital.com, and then I'll be able to just guide them in the right direction for that as well.
awesome. Thank you so much. So, once again, thank you, Monisha, for taking time. And for our listeners, as always, we invite you to like, comment, subscribe, and share. And we hope to see you out at one of our Go Pink pop ups over the next few months. And
Thank you.
we invite you to, again, like, comment, subscribe, and share. And we'll see you back here next time on the Doctors Hospital podcast.
Your health just got brighter with Lamp Insured. Sign up for Doctors Hospital's Lamp Insurance Supplement Plan and enjoy copay waivers and complete access with no upfront ER or inpatient collections. Only $30 per month. Visit doctorshosp.com/lamp to sign up or contact 242-822-1009. That's 242-822-1009. Your journey to affordable and worry-free healthcare begins now.